Welcome to SCALP Acupuncture, Part 14, presented by Lamp AcuWellness Foundation, Inc., as part of its continuing Lamp Lecture series. Principles of Point Selection and Indications. The principles of point selection are based on the diseased area, the symptoms, and the differential diagnosis. This scalp acupuncture prescription is mainly based on the Western medical diagnosis. For example, for an eye disease, choose a point from the vision area. For a stomach problem, choose the stomach area. Based on this principle, scalp acupuncture systems mostly focus on central nerve disorders. Therefore, the new stimulation area of the cerebral cortex, stimulation area of the cerebral cortex, head imaging scalp acupuncture, or the international standard of nomenclature for scalp acupuncture can be used. For example, if the patient has a cerebral disease causing paralysis, we will choose the motor area and the sensory area in the clinic. If using the international standard of nomenclature for scalp acupuncture, we will focus on the vertex temporal anterior oblique line and the vertex temporal posterior oblique line. For the patient who has aphasia caused by a cerebral central nervous system disorder, the disease is usually located on Broca's area, the superior temporal gyrus, or the angular gyrus of the inferior parietal lobule, causing the patient to have motor aphasia, nominal aphasia, or sensory aphasia. Choose the Chiao scalp acupuncture's lower fifth of the motor area, speech 3 and speech 2 in the clinic. For seizure conditions, choose points based on electroencephalogram or EEG readings to locate the diseased area and choose the correct scalp stimulation region. For example, if the patient has a seizure due to frontal lobe damage, choose the point on the middle line of the forehead, line 1 lateral to the forehead, line 2 lateral to the forehead, and line 3 lateral to the forehead of the ISNSA system. If the patient's seizures are located on the vertex, choose an area on the vertex middle line or therapeutic zone scalp acupuncture on the section of the vertex line. If the patient's seizures are located in the temporal area, choose the vertex temporal anterior oblique line and the vertex temporal posterior oblique line. If the seizures are located in the occipital lobe, choose the upper middle line of occiput, upper lateral line of occiput, and lower lateral line of occiput. The practitioner can also use a computed tomography or CT scan or magnetic resonance imaging MRI to locate the diseased area and choose scalp acupuncture to stimulate the surface of the scalp. Point selection is not only based on the Western medical diagnosis, but also on the brain's function and the relationship to blood circulation. For example, if the patient has paralysis due to a brain disorder, not only choose points on the motor area and sensory area, but also choose the new stimulation area for the cerebral cortex function and use 3 needles at the temple as well as 5 needles at the forehead. This is because the damage is not only on the precentral gyrus and postcentral gyrus, but also on the frontal lobe and temporal lobe of the brain. Select a point based on the differential diagnosis. This scalp acupuncture prescription is based on the patient's symptoms and on an analysis using Chinese meridian theory or the Zhangfu theory of differential diagnosis. According to the diseased area, find a meridian pathway or a related meridian with a scalp acupuncture stimulation area zone and line. For example, if the patient has acute low back pain, this belongs to the Du meridian and the foot tai yang meridian. So the prescription will include upper middle line of occiput and upper lateral line of occiput. If the patient has heel pain, this is related to the foot Shaoyang meridian. So, choose the foot Shaoyang, gallbladder 20, as the stimulation area. There are many relationships between the meridians, and scalp acupuncture uses the meridian distribution, energy, and blood flow to select points. Therefore, if the patient has a mouth ulcer, it belongs to the hand Shaoyin heart meridian or the foot Shaoyin kidney conditions. For scalp acupuncture, choose the foot Taiyang bladder meridian, urinary bladder 10 as the treatment point because the foot Shaoyin and Taiyang meridians have an external-internal relationship. The foot Shaoyin kidney meridian also has a branch connecting with the hand Shaoyin heart meridian. Choose a point from the scalp acupuncture system based on Zhangfu function. For example, the heart governs the blood vessels and spirit, but also opens to the tongue. So, if a disease is associated with the blood vessels, is associated with a mental condition, or is located on the tongue, we will choose a point associated with the heart, such as using Qiao scalp acupuncture, thoracic area, Feng scalp acupuncture, upper Qiao area. Tongue scalp acupuncture, heart area, or Zhu scalp acupuncture, front vertex, zone 2 area. In the ISNSA system, choose the forehead lines. Based on the relationship between the Zhangfu, choose a point on the scalp. For example, kidney water can nourish liver wood. So, kidney insufficiency can cause liver yang rising. People will present with dizziness, vertigo, low back pain, and tinnitus. This is mostly seen in patients with a hypertension condition. So, choose line 3 lateral to forehead to tonify the kidney and line 2 lateral to forehead using the ISNSA to sedate the liver. Choose a scalp stimulation area that has specific results for specific symptoms. For example, in Zhu scalp acupuncture, the posterior vertex zone is a clinical experimental area for treating shoulder pain, and the anterior vertex zone is a clinical experimental area for treating sciatic nerve pain, lumbar pain, and leg pain. Select these points for a patient with hip or sciatic nerve pain or frozen shoulder. For a patient with vertigo, choose the vertigo and hearing area. Choose the chorea and tremor control area for tremors in the Jiao system. In Tan scalp acupuncture, most of the stimulation area names have corresponding organs. So, to select points based on symptoms, choose directly from the disease condition. For example, for sore throat, choose the pharynx-larynx area. This is number 8. For anterior shoulder pain, choose the in-shoulder line, number 17. For posterior shoulder pain, choose the yang shoulder line, which is line 32. For palpitations, choose the heart, number 12. For difficult urination, choose the urogenital area, number 16. And for difficulty speaking, choose the speech intelligence area, number 28. Select a point on the contralateral side of the head if the disease is unilateral. If the disease is bilateral, needle the points bilaterally. Select the point on both sides of the head if the disease is of the internal organs or for those that are difficult to distinguish. Scalp acupuncture is widely used clinically for dysfunctions of the respiratory, vascular, digestive, reproductive, endocrine, immune, and neurological systems in the treatment of over 100 different diseases. It has been proven to be especially useful in the treatment of central nervous system disorders, pain control, and acute conditions. Scalp acupuncture can adjust the function of the cerebral cortex, thus improving the circulation of the brain and vascular system. It can improve motor function, improve speech function for rehabilitation, improve associated signs and symptoms, and speed up the healing process. It is used for CNS disorders such as intracerebral hemorrhage, cerebral embolism, cerebral vascular occlusions, encephalitis, meningitis, cortical incontinence with frequent urination, paralysis, aphasia, sequelae of brain injury, sequelae of encephalitis, seizures, chorea, Parkinson's disease. Scalp acupuncture can adjust the excitatory state and inhibitory state functions of the cerebral cortex. It can improve mental function, improve symptoms, and recover normal thinking activity of the cerebrum. It is used for schizophrenia, hysteria, depression, menopause, senile dementia, and Down syndrome. Scalp acupuncture can effectively stop pain and stop itching. It can improve clinical symptoms to help recover normal sensory functions. It is used for pain conditions such as headache, trigeminal neuralgia, neck pain, shoulder pain, lumbar and back pain, sciatic pain, gallbladder pain from infection, stomach pain, and dysmenorrhea. Also, scalp acupuncture can be used for skin conditions such as itchy skin, contact dermatitis, neurodermatitis, multiple or polyneuritis, and eczema. Scalp acupuncture can adjust functional disorders of corticovisceral syndrome. It is used for high blood pressure, coronary heart disease, seizures, sexual dysfunction, irregular menses, vomiting, irritable bowel syndrome, and alopecia. Thank you very much for your attention and see you on our next videos.